Trump's plan to destroy the Affordable Care Act. The proposal, it doesn't come from Trump. Trump couldn't find his ass with both hands. But the plan that's going out over his name to replace the Affordable Care Act will propose giving each state a fixed amount of money in the form of block grants to provide health care for low-income people on Medicaid. That's what Kellyanne Conway said on Sunday. And this lying horse's ass, Conway, said that converting Medicaid to a block grant would ensure that, quote, those who are closest to the people in need will be administering the program. Now, let's get into that a little bit. Changing Medicaid has been an open-ended entitlement ever since it was put into effect in 1965. A block grant is going to involve a radical change of all of that. For example, for whatever reason, recession, cost, expensive new medicines, or treatments necessary to keep folks alive, and they don't have the money to pay for it, they have Medicaid. Well, if more people become eligible, that doesn't mean shit. See, block grants are not flexible. If costs go up under the current plan because of expensive new medicines, states receive more money. Not anymore. When Congress decides to create block grants for Medicaid, the question comes up, and these filthy politicians, Democrats and Republicans, are going to have to resolve this, and you know how they're going to resolve it. But the question comes up, how much money will each state receive? How will the initial allotments be adjusted for population changes, for general inflation, for increases in medical prices, for the discovery of new drugs and treatments? Huh? Will the federal government require states to cover certain populations and services? Will states receive extra money if they have not expanded Medicaid eligibility under the Affordable Care Act but decide to do so in the future? All of these questions, to simplify it for somebody like me, I can put it in one sentence. If the state receives a block grant, and that block grant is somehow allegedly based on the idea of how many people need Medicaid in order to get any kind of health care whatsoever. And then if the costs go up, the block grant doesn't. So then what? Fewer people will become eligible, or people who are eligible will find that certain treatments are being denied them because the costs have gone up. And in the middle of all this, you have these filthy, rotten, disgusting, stinking, capitalist health insurance companies who do not give a rat's ass if patient A or B or C or D dies. They don't care. And you will die. Thousands of you will die because of these block grants if you're on Medicaid. So prepare yourself for it. Or don't. Kellyanne Conway on Sunday Today on NBC said that with a block grant, quote, you really cut out the fraud, waste, and abuse, and you get the help directly to the intended beneficiaries. When she talks about cutting out the fraud, waste, and abuse, what she really means is you have to cut the patient load. How do you cut the patient load? You kill them. That's how you do it. Here's your death panels. Here's your death panels. In the Affordable Care Act, my ass, Here it is now. Here it is now, if this goes through. So with block grants, if you happen to fall outside the budget for your state and you're on Medicaid, and the money runs out, you die. There's no discussion here. There's no appeal here. There's nothing. You die. But that's what the Nazis did. Get rid of the weak, the sick, the disabled. Kill them. And that's exactly what this plan will do. I hope you understand this. I hope you get this. Medicaid covers 70 million people. And it costs about $500 billion a year. More than 20 million people, it says here, have gained coverage under the Affordable Care Act, more than half of them through Medicaid. Now, the new Congress has already approved the budget that's going to demolish the Affordable Care Act. As a candidate, Trump said he wanted to, quote, maximize flexibility for states so they could, quote, design innovative Medicaid programs that will better serve their low-income citizens, end quote. Oh my God. Stop me. Don't let me say the F word again. Bite your tongue, Mike. And on Friday, in his first executive order, he directed federal officials to use all their authority to provide greater flexibility to the states. The House Republicans said back in June that they have this thing called the Better Way agenda to roll back the Affordable Care Act's expansion of Medicaid and give each state a set amount of money for each beneficiary, a lump sum of federal money for all of a state's Medicaid program. Governors, of course, like the idea of having more control over Medicaid, but they're worried that block grants will be used as a vehicle for federal budget cuts. Oh, really? Governor Charlie Baker of Massachusetts, Republican, said in a letter to congressional leaders, quote, "We are very concerned that a shift to block grants as per capita caps for Medicaid would remove flexibility from states as a result of reduced federal funding." See, reduce flexibility. Trump and the assholes that work for him say it will increase flexibility. This is goddamn maddening. I mean, every single thing they say is a lie, is newspeak. Now, the really, to use Trump's words, sad part of all this is how many people who are on Medicaid, because they live in the so-called Rust Belt, and voted for Herr Trump because of the lies and bullshit that he dumped out on them at the rallies, and when they, all of a sudden, they lose their insurance under the Affordable Care Act, and they have to go back to Medicaid, but Medicaid's no longer available to them because the block grant isn't big enough. And then they can go home and tell their family, well, it's time for me to die.